Different people can have very different migraine triggers. That's why if you're dealing with migraines, it can sometimes be helpful to track what's happening around them. Today we're talking about headaches. If you get headaches, you're definitely not alone. Some people get them once in a while, some people get them every week. And then we have some people dealing with headaches almost every day. If you're somebody who gets recurring headaches, you're probably wondering why they keep happening. The difficult part is there isn't one answer. There are a lot of different types of headaches, and there are a lot of different things that can be contributing to them. So today I want to go through some of the most common reasons people get headaches, some things you can look for, and when a headache may be something you should get checked out. The first thing to understand is that not all headaches are the same. A headache is a symptom. Just like back pain is a symptom, knee pain is a symptom, shoulder pain, they all tell us what you're feeling. It doesn't necessarily tell us why you're feeling it. So if two people come into my office and they both tell me they have headaches, I don't automatically assume they're having headaches for the same reasons. One person may be dealing with migraines. Another person may be experiencing headaches that's related to their neck. Someone else may be clenching their jaw. And another person may be stressed, sleeping poorly, not drinking enough water, or dealing with a combination of several different things. So figuring out what's contributing to your headaches is important. One of the first things we look at is stress and muscle tension. When you're stressed, your body responds to that stress itself. A lot of people carry tension through their neck and their shoulders. They tighten their jaw, they sit in one position for long periods at a time. If you're doing that day after day, contribute to your headache symptoms. You may even notice a pattern. Maybe your headaches are worse during a really busy work week. Maybe you're worse when you're dealing with something stressful at home. Maybe they show up when you haven't been sleeping well. That doesn't mean your headache is just stress. You're still experiencing real physical symptoms. It just means stress may be one of those things contributing to it. Another really basic thing to look for is hydration. A lot of people simply don't drink enough water throughout the day, and dehydration can contribute to headaches. Maybe you're also noticing you're thirsty, your mouth feels dry, your urine's darker, you're feeling fatigued. And you tend to get headaches on days where you're not drinking very much. That doesn't mean every time you have a headache, we just need to look at how much water you're drinking. It's a really simple thing to look at. And sometimes we overlook the basics. The same thing goes for sleep. Sleep has a huge effect on how you feel. If you've had a few nights where you're not sleeping well, you're probably noticing it. You're tired, you're irritable, you have trouble concentrating, you may feel even more sensitive to pain. And some people, their headaches become more frequent. If you're getting headaches regularly, I want to know how you're sleeping. How many hours you're getting? Are you actually staying asleep? Are you waking up feeling rested? Because if your sleep is consistently poor, that may be part of what's going on. Then we look at screen time. Most of us spend a huge amount of time of the day looking at something. A computer at work, your phone, a tablet, a TV, and it's really easy to sit there for hours without changing positions. So now you're staring at a screen, your eyes are working, you're sitting in the same position, your head starts drifting forward, your neck and shoulders start getting tight. And by the end of the day, you have a headache. Again, that doesn't necessarily mean the screen itself is the entire problem. It may be eye strain. It may be how long you're sitting. It may be your neck. It might also just be a combination of all of those things. That's why taking breaks, changing position, getting up and moving throughout the day can be helpful. Remember, your body craves movement. It craves that variety. And that brings us to something I see quite a bit in the office. Headaches that actually are related to the neck. These are commonly referred to as cervicogenic headaches. Basically, structures in the neck can refer pain to the head. So you feel the headache in your head, but the neck may be contributing to it. A lot of these patients will tell me their headaches start around the base of their skull and travels upward. Maybe it's more on one side, their neck feels stiff, they have trouble turning their head, or their headaches get worse after sitting at a computer being in one position for a long time. And sometimes when we examine their neck, we can actually reproduce some of that familiar headache pain. That gives us some useful information. It doesn't mean every headache is coming from your neck. It's not. But if you're having headaches along with neck pain, stiffness, or limited range of motion, the neck is definitely something that's worth evaluating. Another area people often forget about is the jaw. A lot of people clench their teeth without even realizing they're doing it. And people grinding their teeth at night. If you're constantly clenching the muscles around your jaw, your face and muscles are working overtime. You might notice your jaw is sore, maybe it clicks or pops, maybe you wake up in the morning with a headache, or you wake up with your jaw just feeling tired or tight. Those are things I want to know about. And because the jaw and neck are closely related, sometimes people are dealing with issues in both areas at the same time. Then we have migraines. And migraines are definitely more than just saying you have a really bad headache. Migraines are a neurological condition, and there are other symptoms that come along with it. You may have nausea, sensitivity to light, sensitivity to sound, visual changes, difficulty concentrating, Some people experience an aura before their migraine starts. And different people can have very different migraine triggers. That's why if you're dealing with migraines, it can sometimes be helpful to track what's happening around them. How did you sleep? How stressed were you? Did you skip a meal? How much caffeine did you have? Did you suddenly stop caffeine? Was there anything different about that day? Over time, we may start noticing patterns. And that brings us into some of the other lifestyle factors that can contribute to headaches. Skipping meals can be a problem for some people. Caffeine can be a trigger, but caffeine withdrawals can also be a trigger. Alcohol can contribute, dehydration, poor sleep. The important thing is that these aren't the same for everybody. Just because one food gives somebody else a headache doesn't mean it's going to cause you to have a headache. I'd rather look for a pattern. What seems to consistently happen around the time that you're getting your headaches. Because the more we understand about the pattern, the better idea we have of what's maybe contributing to them. And that's really why figuring out the type of headache matters. Let's say we have two people who both get headaches 3 times a week. One patient's headaches are primarily related to their neck, the other patient is having migraines. Those are 2 very different situations. So treating both people exactly the same doesn't make a lot of sense. We have to figure out what we're actually dealing with first. And I also want to mention, a headache is something you shouldn't just wait on. Most headaches aren't an emergency, but there are certain situations where you need to seek medical attention. If you suddenly develop a severe headache that's completely different from anything you've experienced before, that's something you need to get evaluated. If you develop significant headache following a head trauma or a head injury, get evaluated. If your headache is accompanied by things like weakness, difficulty speaking, confusion, significant vision loss, loss of coordination, fainting, other sudden neurological symptoms, you need to get prompt medical evaluation. Those aren't situations where you wait a few days to see if your stretching your neck helps. Get checked out. If you're dealing with recurring headaches, especially if you're also having neck pain, stiffness, or limited range of motion of your neck, that's something we can evaluate here in the office. We can take a look at what's going on, determine whether your neck or other musculoskeletal factors may be contributing, and come up with a plan from there. Thanks for watching. Make sure you click like and subscribe. I'll see you on the next one.